Hello and welcome to this week's CEO blog. We want to spend a little time giving you some summary and an overview of activities and projects that are part of our Center for Learning and Innovation here at Pullman Regional Hospital. A lot of activity in that arena, many people involved in reaching out and exploring ways of providing care or expanding our opportunity to strengthen people in managing their health and their healthcare activities. And one of those areas is social work extender that has been developed out of our care coordination services here and Katie Evermann Druffel and her leadership. And so we want to talk about that a little bit today. Katie, help the folks understand briefly what is a social work extender.
Sure. So the concept evolved out of requests and lots of requests from primary care about needing social work services and requesting a social worker follow up with a patient or their family after they've been seen in a primary care clinic. So as hospital-based social workers, we were trying to consider how we could provide services to those individuals and continue our hospital-based work. Simultaneously, we were getting requests from the Human Development Department to collaborate with them on developing a meaningful internship opportunity for their senior human development students who wanted to pursue careers in social work. So out of that came the Social Work Extender program. We had our first student in the fall, and we will have 2 students this summer, 2 more in the fall and 2 in the spring. And they will provide services and be on site at the Palouse Free Clinic and primary care offices. And then we've expanded this year, and they will be spending some time in the subsidized housing sites in Pullman and throughout Whitman County. There's 5 total. And the goal is to work with those clients and patients to help them overcome, identify, remove barriers that they may have in trying to address and get their healthcare needs met.
Yeah. So maybe give a little more information. What's the intersection? Some people may wonder, well, you're a hospital, you provide medical care. What's the intersection between people and their health and access to various social service support areas in the community?
So what we've learned over time is that things like housing and transportation or other stressors that are going on in an individual's life can affect their health either directly or for transportation as an example, if they don't have transportation, they're not going to be able to go and see their medical provider. People don't always have the financial means to pick up prescriptions that a physician has identified would be helpful to them. So all of those things are components that go into someone's overall health, and the goal of the Extender program is to help identify those things with individuals before they require an emergency department visit or a crisis event.
Right. And I think one of the ones that is pretty clear that falls into this category is a lot of health is also related to how people manage nutrition in their lives. And if they don't have the resources to buy healthy food, then they're just going to complicate their health conditions by not eating healthy.
That's right. That's right.
Well, I think we've all recognized in one of the opportunities why this is part of the Center for Learning and Innovation, because it's not really incorporated very effectively into the traditional healthcare model, the availability and the interaction of social services. How are we able to fund some of these social work extenders to be able to trial this?
So we piloted the program in the fall with a student who took the program for internship credits, and we then received funding based on our information that we gathered and shared. We received funding from the Empire Health Foundation. They saw value in not only continuing to do what we did initially with a student in the primary care clinic and the free clinic, but they were particularly interested in having that outreach go even further into the subsidized housing sites.
Excellent, excellent. So there you have it. There's a quick overview. Social work extenders, other groups that find value in exploring that type of new dimension in providing health care and being more comprehensive in bringing all the activities that can impact a person's health and wellness. So grateful to Katie and her staff for taking the lead here and developing this social work extender. Thank you for tuning into these blogs, and I hope you choose to have a great day.